So we know that PD-L1 is a biomarker for benefit of checkpoint inhibition with chemotherapy in patients with metastatic triple-negative disease. But our group was interested to see if we may be able to find other biomarker predictors of benefit. And so we had looked across all the patients at our institution who had received checkpoint inhibitor therapy for their triple-negative breast cancer, and then obtained their tumors and performed next-generation sequencing on them, and looked at genomic alterations to see how they may either correlate with response or resistance to checkpoint inhibition. And what we found was that having a high tumor mutational burden was associated with better overall survival compared to those patients with low tumor mutation burden. And this was regardless of PD-L1 status. So it did seem that TMB by itself may be a biomarker predictor of checkpoint benefit. And then we also found that loss of PTEN, so PTEN mutation, was associated with lack of benefit to checkpoint inhibitor therapy, where no patients really responded to checkpoint inhibitor therapy if they had a PTEN alteration. So, I think further work needs to be done to validate these findings, but I think they are hypothesis generating, and there now is some early clinical data to suggest that using drugs like AKT inhibitors may potentially help overcome the resistance to checkpoint inhibitor treatment, with now ongoing trials adding AKT inhibition to chemotherapy and checkpoint inhibitors that are currently ongoing.